Hi everyone, Dr. Jay Mehta from Mumbai. This is a video where we are going to talk to you about what should you keep in mind before you do stem cell therapy. Alright, so let me please tell this to you. We are going to discuss this in three variants. One is stem cell therapy in the endometrium. Second is stem cell therapy in the ovary. Okay. Third is stem cell therapy in the testis. Okay. So as you all know, this is a very high volume unit for doing stem cell therapies. So we on an average would be doing more than 50 stem cell procedures in every year. All right, that's a very high volume load. Now, what should you remember? Stem cell therapy, basically, when I look at the endometrium, when I look at the ovary, all right, and when I look at the testis, what all is important? So let me first start with the testis. So let me clarify that at the moment, this is in research phase for azoospermia. This is research, all right. We probably need to step into something called as mesenchymal culture, okay, in order to get some benefit in non-obstructive azoospermia. This is crystal clear. So at the moment, we allow it as a research treatment for patients who have non-obstructive azoospermia. Now, this should not be done if there is a genetic cause. Okay, it should not be done. So please remember, if there is a genetic cause of azoospermia, you should not do stem cell therapy. All right. How is stem cell therapy done? As you all know, from your bone marrow, this bone marrow, you are going to draw approximately 40 to 50 cc and you are going to prepare, you are going to stain, you are going to examine the stem cells, and you will have approximately 0.8 ml of aliquot. That means you will have approximately 0.8 ml to inject wherever you want to inject. When I look at injecting stem cells in the endometrium, all right, this should be done for patients who have predominantly Asherman syndrome, or these are patients who have thin endometrium. All right, in both these cases, stem cell is going to give you a 50% benefit as far as endometrium is concerned. That is because the regenerative capacity in the endometrium is actually very good. All right, please remember this. The worst results are going to come in cases of endometrial TB, especially in our country in India, where the results are going to be less than 15% after doing stem cell therapy. Please remember, stem cell procedures are way more superior to PRP. In fact, PRP should become outdated. All right, it's one of the most useless procedures as far as enhancement of chronic thin endometrium or Asherman syndrome is concerned. PRP will consistently give you a success rate of less than 10% in severe cases. All right, in all those cases, you are going to need to do stem cell therapy. Okay, as far as ovary concerned, we were probably people who did a huge number of PRPs in the ovary because we do a lot of cell cycles, but PRP has very limited benefit. That is because PRP is only platelets, all right, and platelets are going to give you very less amount of growth factors. So please remember that it requires activation and it's not something which is really going to help. As far as ovaries are concerned, if you do stem cell therapy in the ovary, then your success rates are going to be on an average between 15 to 20%. People who have AMH of less than 0.1 and FSH of more than 13 to 14 are your actual and only indications, with antral follicle counts of 1 or 2. Okay, if you have an antral follicle count of, let's say, 3, 4, 5, then actually stem cell therapy has got no additional benefit. All right, and as far as ovary is concerned, remember, stem cell therapy will benefit the most if the age is less than 38. That is when the benefit is maximum in the ovary. After age 38, in Indian women as well as in African and Middle Eastern women, the success rate of stem cell is going to go down like crazy. All right, you really need to remember this. Okay, it's an expensive procedure. It requires good team of doctors to do it. Usually it can be done as a daycare procedure, but currently despite all the information I have given you, the consent is for an experimental therapy. Okay, this is an experimental therapy at the moment. All right, so you must remember these things before you fall prey to all marketing practices which are done, especially regarding ovarian PRP. All right, it is something which is excessively marketed, it is something which has got very limited benefits. So please remember this. All right, please remember this. Regenerative science in reproduction is very, very difficult to do. It's not going to be very easy. You need a lot of research in this, and probably I think the answer is going to be in the future in doing something called as mesenchymal line culture. That means we need to identify what is going to work for us. Probably that is going to be the future. All right, we'll be posting these things, but as a clinic we do a lot of these procedures, and that's why I thought it's important to come out with this information for our viewers from across the world. And as a result of this video has been made for all of you in English. All right, any further questions you can post in the comment box. Me or my team members should be getting back to you. Thank you so much. Friends, we are available for consulting in Bombay, Indore, Ahmedabad and Bangalore. Bombay is our primary location. All appointment numbers are mentioned in the description. If anyone is genuinely interested, they may contact the hospitals for the same.